Well, breast surgeon has recently completed the first of its kind surgery in the United States. Here to talk more about this procedure is the surgeon herself, Dr. Katelin Holmes. Thank you for stopping by.
Thank you for having me.
So we were chatting about this procedure. Congratulations first for getting that training.
Thank you.
Talk to me about what this procedure is, what is it called, and who can it help?
It's called a laparoscopic nipple-sparing mastectomy, and we were so proud at Thomas Hospital to be the first in the United States to offer this to women. So what this means is it's similar to other forms of laparoscopic surgery people might be familiar with, like a gallbladder or an appendix, small incisions using a camera, but we've been able to do that for the breast. And what an amazing accomplishment. That's a huge team approach, not just myself, to say we now can bring this to our patients here in Southern Alabama.
And I know you have a lot of humility there. You're saying not just yourself, it was a team, but you were one of 5 surgeons, right?
I was one of 5 surgeons.
In the country.
That's right, from the U.S., and we traveled to Amsterdam, and we received hands-on training from surgeons across the globe, across Europe, Asia, who taught us how to perform this procedure and become certified in it to bring it back to the U.S. so that women here could have that same type of minimally invasive approach.
I'm glad you brought it back to the patient and who this is for. I'm sure it opens up a huge door for options of care.
It does, and I think that's the important thing of being a breast surgeon is we can't be complacent and do operations just the same way they've always been done. And that's what I'm so passionate about and love about this field is let's continue to push the envelope to restore confidence and cure cancer at the same time.
So how did you fall into this profession? I always like to find out, what made you take this path? Because, you do have a lot of passion about it.
I actually worked for a general surgeon when I was very young in high school, and I knew I wanted to be a surgeon, but I loved taking care of breast cancer patients. And I felt like as a woman that offered an extra layer to bring that to the field. And what I love about breast surgery is it's not just a physical disease, it's very much an emotional, psychological, and mental challenge as well. And it is truly an honor to walk alongside women in that journey and help them through a challenging chapter.
It can be a challenge, but it does not mean that it is the end.
That's right. There's so much hope, and that's one thing that I try to bring to every appointment with women, that we have better treatment options than we've ever had before, whether it's minimally invasive breast surgery or advances in chemo and immunotherapy, that the survival is better than it's ever been. And so truly focusing on we have these latest techniques right here in your own backyard, cancer care close to home, where my goal is women don't travel across the country anymore to seek out different options. I want to bring that here.
Sounds good. Thank you so much. Is there anything else that you want to add as we are almost out of time?
I would just say that go back to the importance of yearly mammograms. If you're due for one, this is your reminder. And if heaven forbid they find something, we would be honored to take care of you right here at home.
Thank you, Dr. Holmes, for coming in.
Thank you.